Understanding acromegaly. Causes, symptoms, and management. Acromegaly is a rare but serious hormonal disorder characterized by the overproduction of growth hormone, GH, by the pituitary gland. Because this hormone regulates tissue growth, an excess can lead to physical changes in the bones and soft tissues, as well as significant internal health complications. While the condition is often diagnosed in middle age, it is important to distinguish it from gigantism. If the hormone excess occurs before puberty, while the bone's growth plates are still open, it results in extreme height, gigantism. In adults, however, the bones cannot grow longer, so they instead grow thicker, leading to the characteristic features of acromegaly. The biological mechanism. How it works. The primary driver of acromegaly is usually a pituitary adenoma, which is a non-cancerous tumor located in the brain's pituitary gland. This tumor acts as a biological broken switch, constantly signaling the body to produce excess growth hormone. Once GH levels rise, the liver responds by producing higher amounts of insulin-like growth factor, IGFI. This is a critical connection. While GH initiates the process, it is the surge in IGFI that actually drives the abnormal growth of bones and tissues. Furthermore, these hormonal shifts disrupt how the body processes sugar, significantly increasing the risk of metabolic issues like diabetes. Recognizing the symptoms. Acromegaly progresses slowly, meaning symptoms can be subtle at first. Patients often notice changes in their physical dimensions before they realize there is a medical issue. Physical and aesthetic changes. Facial features. A more pronounced lower jaw, a prominent brow, and enlarged lips or nose. Extremities. Hands and feet that feel tighter in shoes or rings, larger spaces between teeth. Skin changes. Thickened, oily, or coarse skin, often accompanied by acne and skin tags. Body structure. A wider rib cage and increased sweating or body odor. Internal and neurological signs. Pain, chronic headaches, and joint pain. Vision. Changes in eyesight, often caused by the tumor pressing on optic nerves. Voice. A noticeable deepening of the voice. Treatment pathways. While not all cases can be cured, in the sense of making the condition disappear forever, modern medicine offers several ways to manage hormone levels and prevent life-threatening complications. Surgery, often the first line of defense. Surgery aims to remove the pituitary tumor. Even if the entire tumor cannot be removed, reducing its size can make other treatments more effective. Medication. Various drugs are used to either lower GH production or block its effects. These include somatostatin analogs, e.g. octreotide, lanreotide, dopamine agonists, e.g. cabergoline, growth hormone receptor antagonists, e.g. pegvisomant, radiation therapy. If surgery is not an option or is only partially successful, targeted high-energy X-rays can be used to destroy remaining tumor cells. Prognosis and long-term outlook. The outlook for a patient depends heavily on early diagnosis and the size of the tumor. Medical experts categorize prognosis into 3 types. Type 1, generally older patients with fewer symptoms and lower IGF-1 levels, best prognosis. Type 2, intermediate prognosis. Type 3, younger patients with severe symptoms or very high IGF-1 levels, most challenging prognosis. Note, even with successful treatment, physical changes that have already occurred, such as bone thickening, may be permanent. The risks of untreated acromegaly. Ignoring acromegaly can lead to a cascade of systemic failures. Because the condition affects the endocrine and metabolic systems, the complications are widespread: cardiovascular, hypertension, high cholesterol, heart disease, and heart failure. Metabolic, type 2 diabetes. Respiratory, sleep apnea. Other risks: increased risk of various cancers, colon, breast, prostate, arthritis, and even mental health challenges like depression. Summary. Acromegaly is a complex hormonal disorder driven by excess growth hormone, most commonly caused by a pituitary tumor. While it causes noticeable physical changes and serious systemic risks, early intervention through surgery, medication, or radiation can manage the condition and allow for a normal life expectancy.